Hey, this is Dr. Todd Brennan, Healthy View Podiatry. So we have a good case today. We have a wart excision. The patient tried some topicals with no success, so we're going to excise it today. I know a couple videos back everybody talked about wanting to see more wart excision, so for your viewing pleasure, we have one today for you. I will do it slightly different than you might have seen on some of our previous videos. Again, just different techniques per different doctor, but it works for me. So she's in the room now, so let's go. So you can see the wart right here, the outline of the wart. We already numbed it up, so she's not feeling anything. So I do it slightly different. I don't use the tissue nippers like Dr. Crowitz does. I just use a 15 blade. That way I can kind of control the cuts a little bit more closer, if you will. So you can kind of see the wart there. So we get more of the wart, that way we make sure we get it all. So you can see this is the border around the wart that we'll get. It almost looks like celery is the way that it's described, and that's how you know you're in the level of the tissue that is no more wart. So I was doing a wart excision on somebody, and I went to numb them up, and it was like in their arch of their foot. And I trimmed it up like I did yours previously, right? And when I went to numb it up, so warts are very vascular, and when I injected it, the anesthetic shot through the wart and hit me in the eye.
Oh my gosh.
And the patient looked at me kind of funny, and I went to the bathroom and flushed my eye out. When I came back, it was an anesthetic, so my eye was like droopy for like 4 hours. I looked pretty goofy. So that's why I cover it up when I inject it now, because I don't want to get shot in the eye.
Yeah, no kidding.
All right, so you can see here, we made it bigger again than the wart actually was, but that's why we want to make sure that it stays away for good. And you can see again, the texture of this tissue is how we know that we're below or deep to the wart. Also the way it bleeds, warts get a bunch of little dots of blood, so you can see just one center portion of blood. The other thing is the skin line. So a wart, typically the skin line hits the wart, goes around it and goes to the other side. For this, the lines are going straight through it, so that's how we know we're in the center. So what we'll put on here now is some silver nitrate. What the silver nitrate does is it helps to stop the bleeding, and it also helps to kill any remnants of verrucal or wart tissue, basically, that are left. She'll be able to walk on this. We'll put a wrap on it. The wrap will stay on until she showers next. And then whenever she showers, this will all come off, and you're gonna put basically Neosporin and a Band-Aid on it, okay? But overall, she'll have a little bit of pain afterwards, nothing that some ibuprofen or Aleve won't handle. But overall, that will do the trick. So as of now, your wart is gone.
Thank goodness.
No more wart. Now we just need to finish healing up. So we'll check it back in about 3 weeks, and it should be nice and healed up. That's it.